Almost around 16 hours you spent here.
Yeah. And actually at noon, yeah, we have the break time, but I can't do anything else, right? So it's 15 hours.
So I'll take out this sleep while finish. See if we forget. How much you're able to give your family time? If you wish to share your, if you're not married, how much time you're spending with your parents and brothers and sisters? Married, how much time you spend with the family?
At present, I think just 1 hour. Yeah, 1 hour.
See, what is important for us? We work for the family. We work for the family.
Yeah.
How much time we give for the family?
I know.
So, just one ask. How many hours you watch TV?
Watch TV?
No.
I don't watch TV.
Never.
I do some major things. I mean, I have some hobbies.
Half an hour, 1 hour, 2 hours.
2 hours.
Every day?
Yeah, as much as I can do.
Every day 2 hours means you're luckiest person.
That's it.
So you're happy with your work life?
Not really.
No. I say this side is.
That's why I come here actually.
If you listen to my advices, you'll run away from here. So I left all the jobs. I stopped all the jobs because I was thinking, what use I'm doing ultimately. I'm going and earning and coming back and spending. Not able to spend much time with the family and just giving money.
But I just wonder because most people do yoga, they don't have a job, they don't have a daytime job. So, how do you guys survive?
I survive in a very minimal. I do work. I work as a consultant.
Yeah.
Consultant, I go there, not with their time, their demand. I go with my time, my patient, 1 or 2, 3 or 10 patients I see and then come back. That will give me some livelihood. I earn somewhere around 800 yuan to 1200 yuan per month. That's why I come here. So we are more or less fine. So if I say work and life, you're okay. When the workload here on work side, you are spending more time, it's still you're okay. Any pain, back pain, neck pain, anything?
Yeah, I think my shoulders are like here, and waist, back.
Lower back pain.
Yeah, lower back. Yeah, lower back. And legs.
How many hours of computer work?
Huh?
How many hours of computer?
Most, yeah.
Not much.
Yeah. Just my work hour.
Is computer work?
Completely, yeah.
Work on the computer.
And when I'm busy, I cannot, stand up or go anywhere.
Okay. Do you get burning sensation of eyes? Burning of eyes?
Yes. My
Like this you feel?
the ability is not good, I think. But I don't wear the glasses, but it's not good.
So you are able to refine and define what problems you are facing which are non-infectious. Not infection, but still there is something not okay. Tell about you.
I'm Nicole. I'm from Malaysia.
Which part of Malaysia?
Which part? Ipoh? Okay. So I'm a yoga teacher. So mostly my time is in leisure.
Your time is like this.
Okay.
So family?
No, yeah. I away from my family, so I'm yeah.
Work is leisure, teaching yoga.
Work,
Travel?
leisure. Travel a lot of time.
So this is one of the most dream come true. Where I travel leisurely, teach leisurely, come back home leisurely. So all the time is your leisurely time. So it's dedicated for it. So this is what I was planning and I was trying to do it. So this is what so yoga
So I
teacher.
don't
yoga practice per day?
1 hour.
One.
1 hour.
Teach?
Teach
What
3
exactly you
hours.
teach? 3 hours you teach. You practice for yourself 1 hour and you teach 3 hours, 4 hours. Already
Yeah.
physical exercises you are already doing.
Yeah.
So no emotional issues, getting angry, not able to sleep,
No.
not much at the physical levels, not much problems.
No.
Well and good.
I think we should all become yoga teacher.
Yes.
I'm Becky, and I'm working in the school as a principal. Okay, and so I work from 7 to 6 or 7, so it's almost 12 hours.
12 hours?
12,
12, okay.
Monday to Friday. But I got winter break and summer break, which is great. So here is my winter break. So completely relaxed and reading and doing yoga.
So that's why you're able to come for all the classes.
Hmm?
That's why you-
Yeah, that's why I can come. Yeah.
Lucky winter.
Yeah, so I love this job. It's the job, I enjoy my work because I love the children and I love my teachers. So at work, I have stress is the schedule, but with the people, of course, sometimes I need to communicate with people who are not communicating with me. Okay, so that's my main frustration. But otherwise, I enjoy my work. So that's why I can stay 12 hours.
So
Yeah.
you have made your work as a passion. You're passionate about your work, so you'll not feel tired.
No.
How's your sleep? How's your mind, emotions,
Yeah,
energy levels?
I'm over worried, so I do not get good sleep. Usually I have a lot of dream. And whatever I think in the daytime, I dream the solution in the night. And that's why I get up tired, but I still have to work. So it's a kind of vicious circle for me in terms of sleeping quality. Yeah.
See, remember 2 minutes before I said non-infectious diseases, infectious diseases. Non-infectious. There is no infection which has caused this, but the lifestyle has caused this. So it's not infectious, but still it's affecting, as similar to infectious diseases. As you said, vicious cycle. So somewhere we have to break. That break.
I do have weekend and the evening to do some yoga.
Yeah.
Okay, so and my husband does it with me. It's a good common habit together as a couple.
So it's one good stress buster. Your life partner is also giving you a cushion or stress absorbent, and it's a mutually helping each other. Well and good.
Namaste everyone, my name is Ritambra. I live in Shanghai and I'm teaching yoga in the companies, so I'm here for them.
So,
Yeah, I love my job actually. So it's the same situation with like, so I'm happy with my life now.
No much complaints.
No much
Body,
complaints.
mind, soul, fine.
Yeah, every day I spend a lot of time chanting mantra
Which
because
mantra?
I follow the Buddhist way.
Om Mani Padme Hum.
And like this. And practice yoga at home and with my teachers. Yeah. So I'm happy to
Happy with your work.
teaching. Yeah. With my work, with my learning, so everything is good.
Anish, बता अपने बारे में बता छोटा सा.
Namaste everybody, I am Hanish coming from India and I am teaching here. So I am just thinking that I am not working here. I am just sharing my knowledge to everybody. I am serving to the society, serving to the humans. So I am happy.
We forward it.
No problem. I'm very similar to her. Very long working hours. My day job is sometimes 16 hours, sometimes 8 hours, because it depends on project deadlines. And sometimes I work on weekend also. I spend 1 hour on average to do yoga every morning.
In spite of this time.
Yeah. That's what gets me going. 1 hour for family. Commute, today commutes, I think 45 minutes one way, so an hour and a half both way. But I also travel internationally for work also. So on average, I probably travel quite a lot, wasting a lot of time on the road.
Okay. So at the background of your mind, you are designing already how I can use this my working time to do some help for myself and my body, mind and soul. Just by listening to this, you should be able to design something at the back of your mind.
Hello, I'm Jeanette from Philippines. So it's my first time here in yoga. Today I would like to thank Sir Garnish. He asked me to come over here to learn a little bit of yoga. I think I work more than all of you because I have 2 works. So one mostly in a restaurant and then in the morning in company. So I'm very lucky if I have 8 hours sleep. So mostly it's like 4 or 6. And most of my time is only to work. Work home.
16, 18, 20 hours?
Probably maybe, let's say if 4 hours it means 20 hours at work. Or 16 to 20.
So work in this work definition, you also include the commuting time also.
Yes.
If you include commuting times, you say 20. Did you say 20 hours?
Yeah, sometimes.
20 hours, 4 hours sleeping. Then where are the rest of things? Tell me about time today.
No, work, it was actually work. She came here for work. She came here for work. I just pulled her inside. I told her to come inside.
Okay. So any problems at mind?
Yeah, actually lower back pain, here, and sometimes also the same, like sometimes you're sleeping but it's like you're working also. It's like your mind is working.
Mind is thinking too much.
Yes.
So are you able to define the problems at the back of your mind already? Yes. We saw even in this smallest of group, statistically, more people are complaining of low back ache. So we will see why.
Yeah, I've pretty much worked towards that now.
This one?
No, the bottom one. The bottom one, yeah. No,
The circles.
The circles.
Cool.
Yeah, I was up there before,
Yeah.
and now I'm down there. I actually work at an integrative medicine clinic where we
Where?
practice function.
Yes.
Ensemble number 12,
Okay.
where we practice functional medicine, naturopathic, and TCM.
Super.
So I handle all the events marketing. But I'm a consultant, I'm not full-time, so I'm pretty free. I can go there when I need to for meetings.
You are like workplace consultant or integrated consultant? or a
More
doctor
event
consultant?
planning.
Event planning.
Event planning for the clinic.
Events, doctors, patients together, some events.
I organize events to promote our services, but it's more towards promoting wellness.
Okay.
Yeah, where we combine some medical aspects and healthy living, healthy eating, and also collaboration with different partners.
So in
Yeah,
short,
so-
you'll say,
So I've definitely worked from up there to down there now.
yes,
Sorry?
lifestyle modification programs.
Yes. I did a career shift. I used to be in fashion, luxury sector for 17 years. And it was a lot of hours and a lot of travels and blah, blah, blah. And then I
Blah 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 is the life itself. Very good to know you. So next is
My name is Lakshmi Arjun. Before it was freely my India, I come Shanghai after more happy, more friends and more activities, and my life is changed. I'm more happy. Any problem, I adjust.
Very good attitude.
Yes.
adjust. We use this word adjust throughout.
Hi, my name is Ganesh. I'm also from India. I'm in Shanghai for quite a long time. So when it comes to work, I take it as all the work. Like throughout my 24 hours, I'm working. I'm also in Malaysia. I'm also traveling. But health issues are there because I'm just lazy a little bit. Other than that, I think.
You look lazy because your mind is working too much. Body
Working too
cannot
much.
cope up with that.
Yes, and I feel it's quite okay at this point of time. I take it because I do it because I want to do it. So there's some passion behind it. There's some goal behind it. I think I'm pushing too much towards it. So I find it entertaining myself. So the entertainment part is also 24 hours. Yes, I do have planning whenever there's a designing of a place and designing of a product or something. Even in my sleep, I do design it. I do design it. So but those experiences are something with awareness. Like I'm being aware of those experiences. And I find it, yes, tiring in the morning, yes, I feel it like, okay, if I have to take a class in the afternoon, probably, yes, I will not be performing well. So if I can modify the place, modify the daytime that I don't take a class, but still I can send the teachers or do something like that. So I'm still prepared. Like I'm trying to work on all the aspects so that during the non-attentive or lethargic stage during the daytime.
It's the first time I heard him. So I want him to get succeed for just yoga because he is trying to do it and as authentic, as traditional as possible. So not just branding. Branding is just there to show it, but he's trying to work so much. So I love to work with you also. So already in this also we are doing a business deal here. So it's interesting. I see now after understanding this group of people, I know that this is not just a simple people who are having some back pain. I can teach you some back pain exercises and go home. No. Actually, for some 1, 2, 3, I need 4, 5, 6. I need to teach something where they can take home and they can do it for others. They'll be able to evaluate alignment. They'll be able to do something for themselves. It's a little extra knowledge where they can take it and adopt it in their routine yoga programs or in your integrative medicine where they can take up something. But for me to build this plan, I took a lot of references from different schools, different doctors, different people I went and met, and I think collectively it will be useful for you. Maybe tomorrow I'll be, or after the break, we'll do some evaluations at the physical level, mind level, and I'll tell you how to do it non-professional way also. Simply, I'm a doctor and I do it, it looks nice, but if a yoga teacher tries to do this alignment, they should be able to do it well. So I have a simple tools to do it, which I'll tell you now. It's nice to know you.
Doctor, tell something about you.
I'm a madman. After my MBBS studies, I was starting a clinic. When in clinic, everybody wants to ask me that, okay sir, I'm having this problem and give me quick fix. I want to take tablets, I want to take injections, I don't mind. I don't want to do exercise. This is a common tendency. I don't have time. This is the most common tendency we have. Are we able to give time? So no time. So this is also says, I don't have time, let me stay with you. I don't want to do. I have enough time. This is will say, I have enough time. So I used to say that, am I doing justice in my medical career? I'm just treating the symptoms. And I know the cause is somewhere else and I need to touch that cause at least. And even to spend with the time with the patient, I need to know the patient fully. Unless if I ask somebody, you're having acidity problem, I'll give you antacid to counteract the increased hydrochloric acid in the stomach. Unless and until I know the mind of a person, what he or she is undergoing at the subconscious level or conscious level, what trauma she or he is undergoing, I'm not able to remove the cause, but I'm just treating the symptoms. I was not very happy. So then I left my clinic practice and then started my MD in yoga and rehabilitation. It is totally different field, going to a modern medicine. And next was my next super specialty. I turned back, going back to MD in yoga and rehabilitation from the same school. 1, 2, 3, 4, all from the same school. I did my MD in yoga and rehabilitation. He did MSc, he did MSc, Amma did other course, PG Diploma in Yoga, and MSc also she did. So this was a life-changing thing where I used to say, what I have in my India to give back to the West, everything I'm just following British medical system. What I have, an Indian origin, to give it back. Every time answer used to be yoga, Ayurveda and spiritual aspects, which I can give it back. And I was thinking, I am lucky enough to know the body myself, being a doctor. I am lucky enough to know the disease, lucky enough to understand the mind. If I work a little bit, I can able to understand the mind. So why can't I use this therapy with some evidence base? So that was a beginning point of integrated medicine in my particular individual life, where I can give it back. So this is how I try to build it out and work out. Do not bug your mind too much. Workplace wellness is the biggest industry where this information for yoga, statistical information, more than 80% of earning of yoga comes from workplace wellness programs, stress management programs, or as an individual person, if you have a yoga studio and earning, that's a different aspect. People are coming to you and you are doing. So more revenue can be generated by workplace wellness program, by yoga and other integrated activities. So I wish those yoga teachers who are here can integrate other things also in their routine career and use it for better, refined, sharp quality services to other people. So this is how statistics works. And when I say complementary and alternative medicine, top 10 complementary and alternative medicine, first one is acupuncture, acupressure, and other traditional therapies. Second, third, I don't remember, I don't know. Fourth one is yoga. Second, I think it's a massage therapies. Third or fourth one is yoga, and the sixth one is Ayurveda. So statistically, top 10 complementary alternative medicine, definitely your indigenous traditional Chinese medicine, acupuncture was foremost because it was most proven, efficient, evidence-based alternative therapies available for the medical community to give it back to the people. That's how acupuncture comes first. So yoga somewhere 4 or Ayurveda. So top 10 modalities of alternative therapies are yoga and Ayurveda for me. This is statistical information. Other 10 you can just check it on. Needle therapy, moxie and other therapies. Indigenous Reiki healing, pranic healing, prayers. Prayer is also top 10 therapy. I cannot do anything, just I can pray. So those are all top 10 complementary and alternative services. For me to give it to others, I need to know it for myself. So as I given a statement, 70% of primary physicians visits are related to stress. So I need to know about it a bit. So in our body there are two types of nervous systems. One is at the level of center, we call central nervous system, brain and spinal cord. Brain and spinal cord. It's called a central nervous system, you can call it a CNS. And nerves attached to it, the peripheral nervous system. It will not be this gross, it will be super refined peripheral nervous system. You're okay with this? If I ask you to raise your right hand, can you raise all of it? Raise your right hand. Up your hands back. So my voice travelled in the medium of air and it has reached your voice, and your ears have sent a signal to the brain that something you have comprehended with your brain, and then you send a signal to your arm that raise the arm up. So that is under your control. It is voluntary. Yes, it is under your control. If I ask you to control your heartbeat, stop your heartbeat for 10 seconds. Can you stop? No.
Maybe
So,
he can do that.
to become a yogi. Yeah.
Some yogic people can do. So that is that can be called as an. I'll come to that part. The peripheral nervous system, it's divided again into voluntary and involuntary. Involuntary nervous system is again divided into two. Sympathetic, parasympathetic. See, in this, each information is very important, maybe from my standpoint of view, so that you can design the protocol by yourself. It is like giving you techniques to catch a fish, not just selling you a fish. So which one is better for you? If for office workers, if I teach you some 20 stretches, some 10 breathing techniques, or some 2 breathing techniques, 2 meditation techniques, and wind up the class, will it be good for you, or you want to know why you have to do this?
Let me just translate this bit before checking. 就这个老师说的是中枢神经和周围神经，然后周围神经这边分出来了有这个自主神经和非自主神经。这个 involuntary 是自主神经这一块又分成了两个，一个是交感神经，一个是副感神经，然后就会主要教这两个交感和副感神经。这个就会等一下他会教你跟这个相关的训练，然后就会帮助你怎么样来把这个 stress 还有其他东西减少，控制我们不能控制的那些东西，通过这些练习。
Sorry, so CNS is involuntary.
那个是中枢神经，中枢神经。然后 PNS 是周围神经，周围神经下面又出来
Central
了
nervous
这
system
个。
is both involuntary and voluntary. For example, I am walking and suddenly needle is pricked. Signal goes to my spine cord without even before registering, I withdraw my leg. So it is an involuntary reflex.
Right.
And same, I use my brain to walk and do the voluntary activity. Central nervous system is controlling everything. So it is both involuntary and voluntary.
Both. Okay. And the other one is
It's a peripheral nervous system.
para
Peripheral,
or peripheral?
peripheral.
周
nervous
围
system.
神经。
Okay.
心脏那个是另外一个，心脏那个是肌肉，那个是就是平滑肌、骨骼肌和最后这个心肌。
I'll give you an example. A deer is running for its life from a tiger. What will be the state of the deer or a zebra?